Before there was if I sit there was pain, if I'm standing there was a lot of pain. Now I can stand without.
Okay. How much time you are able to stand?
I can spend for half an hour, 1 hour without.
Great. And walking?
Walking there is no pain at all.
Sitting?
Sitting earlier there was pain, now there is no pain.
So how much time you are able to sit now?
I am able to sit for the whole of office working hours.
Hi, this is Dr. Rahul Gulve, this is Certified Chiropractor, manual therapist and pain man specialist. So today we have Mr. Rajesh Sha ji, aged about 50 years. He's having a low back pain and left leg sciatica. He's suffering from past 4 years. And the intensity of pain is on and off, right sir? MRI says he's having a partial sacralization and he's having disc bulges from L3, L4, L4, L5 and L5 S1.
I have pain in my back, I have pain in my hip area, I have also pain in my calf right now.
So how intensely you are having the pain?
Morning I am not able to do my routine work in the morning. It takes a lot of time for me
Okay.
to do the routine work. During the day the pain subsides, but again I am not able to sleep peacefully because when I change the sides in the night it is still paining a lot.
Okay. So for that, do you have taken any other treatment?
No, we have not taken any other treatment. I have read about Mr. Dr. Rahul on the internet, and then I decided to visit him. I visited him in February, but then I was traveling, so I came back. I now want to start this therapy. Today is my first day for the therapy.
Yes, yes.
And he has advised me to do 28 sessions, and then I will follow this protocol and see that I get rid of this problem forever.
Yes. So as we have planned 28 sessions for his, because there is a severely protruded disc at L4, L5, just compressing bilaterally, and there is we can see bilateral neural foramina narrowing. So there is a severe disc bulge. So we have planned 28 visits, and as is the first visit, so we'll start treating him. And within the planned visits, hope we can clear his issue as he is not able to sleep and the morning stiffness, the nerve pain is more, right?
Yes.
Shall we start?
Yes. One more thing, I visited the orthopedic doctor. He advised me to do the surgery.
Surgery, yes.
When I visited Dr. Rahul, he said this can be cured without surgery. So that's my starting point. I hope that this will help me to get to the normalcy very soon.
So we'll try our level best to get back into the normal. Lie down on the sideline.
Right.
So pain is more here, right?
Yeah. Yeah.
This one. This.
Yes.
This one also. Yes. Can you please lie down on your belly? Just flex this leg and just manipulate you. Okay. Down. Okay. Right. Just be relaxed. Be relaxed. Just be relaxed. Relax. So we manipulate the upper segment. Just hold it, don't breathe. I'm just pulling you. Okay. So we have just flex it. In the treatment of reversing diabetic. That you should relax. Yes. Just relax. Just relax. Just relax. Relax. Yes. No. You relax. Fine.
Right now there is no pain here and here.
Do you feel any change after manual therapy?
I feel little more comfortable in walking. Right.
So as we have completed manual session, we will go with the other therapeutic approaches, right? How much difference you can see after this 11 visits in the bending forward?
There is a difference for sure.
In bending also. Okay. So what about the walking and intensity of it?
Now there is no, if I walk there is no problem at all.
Before?
Before there was if I sit there was pain, if I am standing there was a lot of pain. Now I can stand without pain.
Okay. So how much time you are able to stand?
I can spend for half an hour, 1 hour without.
Great. And walking?
Walking there is no pain at all.
Sitting?
Sitting earlier there was pain, now there is no pain.
So how much time you are able to sit now?
I am able to sit for the whole of office working hours. So earlier morning 1 hour was very difficult. I can't stand.
Okay.
I can't do any routine
Okay.
because in the moment I stand, I see the pain here. I see a lot of pain here
Relating to numbness to your left leg.
to the here this area and here. So first 1 hour when I get up in the morning was very difficult.
Oh.
Now it's only first 5 minutes. And after that I feel very relaxed. Then I am able to do my routine work.
Yeah. Good.
And I am able to sleep well. Earlier I used to sleep only on one side
Okay.
because the moment I turn the side I was facing the pain. And now I can sleep flat.
Okay. You are able to sleep in a supine position, relaxed position.
Relaxed position also.
Right. We'll move like just bend forward. Fine. Fine. See you.